Hi, my name is Sally and I'm going to be demonstrating today a subcutaneous or sub-Q injection, as they're called, on a cadaver dog. Typically you would not need exam gloves for this, but you may choose to do so if you wish. Quite often we're doing sub-Q injections in the scruff area of the animal. The instances would be for medications or even giving bolus of fluids that way in the scruff region. The exception would be for vaccines. For cats and dogs, we're going to be doing those as distal on the limb as possible and lifting up the skin, creating a tent, and injecting the substance underneath the skin, above the muscle layer. I'm going to be using just some sterile water today in a 3 cc syringe. Because this is a multi-dose vial, I'm going to wipe the top of it with some alcohol, and I'm going to draw up using proper syringe technique. Notice my vial straight up and down. You'll also notice to get any air bubbles out, I'm going to hang on to not only the vial but also the syringe itself and just give it a few little taps to get out the major bubbles. Or I can pull down on the syringe and push back up to get out some of the major bubbles. Little teeny tiny ones we don't need to worry about. Pull out. And now I'm going to pick up the scruff area behind the ears and the neck region. This is where cats in particular carry their kittens by, so it tends to be not as sensitive an area. I'm going to use some alcohol and just wipe. You'll notice I'm picking up kind of a piece here, and I'm making almost a tent formation. If I were to poke my finger here, I can feel the cavity or that area underneath the skin above the muscle layer. I often like to put a finger there just to make that triangle a little more pronounced. And often if I'm showing clients how to do this, I'll use my finger and have them use their finger so they can feel that space. I'm going to use some sterile water for this demonstration. I've poked through the vial, wiped it first, and I'm going to change out the needle as well. So I'm going to put a new needle on. It's a good idea to remind yourself anytime you're poking an animal, is this a new needle? You always want to use a clean, sharp, new needle for your injection. I'm going to take off the cap carefully. I'm going to have my bevel up, and using, again, proper syringe holding technique, I'm going to go in about a 45-degree angle here into that cavity and pop through the skin. I'm going to pull back to see if I get any blood. If not, I'm going to inject my substance slowly but quickly. I'm then going to pull out the syringe, dispose of my sharps correctly, and I like to just lower the skin and give it a little rub. You'll notice again that this triangle here has created a cavity. I'm looking though to make sure that I haven't gone through this skin fold with my needle. If that was the case, it would maybe be able, you might be able to see it, but you would notice that your substance, a vaccine or whatnot, would have dripped out the other side. That's why we don't want to just take a fold and go through the fold. It's much better to have that triangle technique and go in that cavity about 45-degree angle. But again, once I let that skin down, I'm looking for any wetness that may indicate that my vaccine or whatnot has gone out the other side.